Good evening, everybody, and welcome to this meeting of the Health and Adult Social Care Overview and Scrutiny Committee. My name is Councillor Patrick Canavan, and I'll be chairing the meeting this evening. Welcome, everybody, and welcome anybody watching online. I'm going to start by asking the Democratic Services Officer if they would read out the housekeeping notice, please.
Thank you, Chair. Please note that this meeting is being recorded by the Council for live broadcast and will be published on the Council website for a minimum of 6 months. The meeting may also be recorded or streamed for live or subsequent broadcasts by members of the public, although ultimate discretion in this matter lies with the Chair in case of disruption. For those in the room, please note that if the fire alarm sounds, please exit the building by way of the nearest available signed fire exit route and make your way to the assembly point in front of the car park of this building. Finally, please ensure background noise is kept to a minimum and mobile phones and other devices are turned off or switched to silent for the duration of the meeting. For those in the room, this includes turning off microphones and turning down the volume on your laptops completely. Thank you.
Thank you very much. So do we have any apologies, please?
Yes, Chair, we've received apologies from Councillor Dwayne Farr and Louise Bates from Health Watch.
And substitute members?
Councillor Cameron Adams is substituting for Councillor Dwayne Farr this evening.
Thank you very much. Welcome, Councillor Adams. Thank you for joining us. Declarations of interest, please. Councillor Salmon.
I work for Dorset Healthcare.
Thank you. And Councillor Allen.
I work for the University Hospitals Trust.
Thank you very much indeed. So we have the next item, which is the confirmation of the minutes. So I'm hoping that everybody's okay with the 15th of July minutes. Everybody content? I accept those as a correct record?
Yes.
Thank you very much. So apologies about the action sheet. Somehow it seemed to get disappeared into the ether, but it has been circulated not long ago by email. So hopefully you will have received that. I will come back to it later on, just in case as we go through the meeting, there's anything on there that occurs to you, but otherwise we'll just take it as a matter of record. But if you do spot anything as we go through, please shout at some point. Thank you. So, Louise, have we got any public issues?
There are no public issues, Chair.
Thank you very much. So we're going to move on to item 6 on the agenda, which is the... Yeah, we're just going to pause. We've had some... Okay, we're going to resume. So we've accepted the minutes and we have seen the action sheet, which I will come back to if anybody wants me to, and we have no public issues. So I'm going to move on then to item 6 on the agenda, which is the Fulfilled Lives programme. I'm going to ask Gillian to present this paper, and just to, I think, by way of introduction, say that this is a suggested approach to scrutiny, and obviously it's something that we will be looking at once Gillian's given us her thoughts. Thank you.
Thank you, Chair. The Fulfilled Lives programme is our transformation programme for adult social care, as I'm sure the committee will remember, and it's an area that the committee suggested you want to focus on. And indeed, when Cabinet and then Council agreed that we should set up the programme, there's a specific request to Scrutiny to closely work with officers and to scrutinise the programme as it develops, with a particular focus on the 4 priority projects, and also looking at the risks and opportunities of data cutting across the programme as a whole. The programme is one that is a long-term programme that's about delivering really sustainable change in our adult social care services. So it's the commitment the committee's making to scrutinise it is a long-term one too, and we thought it was worth putting forward some suggestions to you about how you might want to approach that task. What the paper puts forward is a suggestion that you have a regular drumbeat of opportunities to scrutinise the programme's work. And that you take the opportunity of your meeting in November, or first briefing session in November, to focus on two areas. The first is the How We Work project, because that's the most advanced of the 4 projects, because it builds on innovation work that we've already been doing, and it's a really fundamental building block of the whole transformation programme. And the second area we've suggested is that piece around the risks and opportunities of data, because it's one that we want to have the conversation early in the programme so that we can really build in the thinking that comes from it. So that's our suggestion, but of course the committee may have other ideas about areas you want to focus on and ways that you want to approach it, which we are absolutely open to hearing about. And I should say, I'm here in the room. We also have on screen Betty Butlin, the Director of Adult Social Care Services, and Siobhan Han is also there, who leads on some quite important aspects of our commissioning work that's part of the transformation programme. And I know commissioning is also an area that you might want to take an interest in at some point. Thank you.
Thank you. Any comments from members of the committee in relation to that? So just breaking that down a little bit, our colleagues generally content that approach in terms of the timescale rather is appropriate, that over the next 18 months that we do look at those 2 particular projects, and that we make a start on doing that at the 4th of November. So that's a kind of timescale question, if you like. And then the other sort of second question really is, are you content that those 2 items that are being suggested are the most appropriate, or is there anything else within that range of work that we know we need to do to scrutinise this big piece of work? Is there anything else that jumps out at anybody that we might need to find a way of building into that timetable? Councillor Moriarty.
Thanks, Chair. I would like at some point to be able to look at point 7, which is self-directed support programme, micro providers. I would like some more details on what does that mean really, and a diverse and available provider market. I have some concerns as to just exactly what that means. Are we looking at outsourcing? Are we looking at anything that's kind of external to the council? And I would like to scrutinise where that is coming from, really, if that's okay. Thank you.
Yes, absolutely. And Siobhan might want to say a little bit more about that piece of work now, and the areas and the timescales where we think that scrutiny might be most helpful. Siobhan, do you want to come in on that?
Yeah, so just to explain what micro providers are. So they are actually small providers within our community. So they're normally sort of 8 volunteers or 8 workers and below. So it's really just about developing a wider market than we've currently got. So we've got quite large providers. So we're going to be working with a community catalyst who bring in a worker who will come out and work with our communities to allow them to develop those providers and kind of just develop a much wider market for us. The timescale for that is starting pretty much now. We're bringing in and recruiting the new micro provider liaison officer, as it were, and then we'll be starting to go out and starting to advertise for those different organisations, starting to understand what sort of organisations, what sort of services that we might need, what sort of different organisations that people are asking for in terms of the different sort of day opportunities or domiciliary care providers, person assistance, those sorts of services that we'll be looking at. So we can probably start to provide some sort of data perhaps in the first quarter. So sort of February, March time, we might be able to start to provide some data for you.
Okay, just to clarify then, in terms of that process, so in terms of trying to identify those micro providers, that really work, you're kind of doing the preparation work, as it were, now, and that you'll
absolutely
be more in a formal commissioning process in the early part of the next year?
Yeah, so the work is starting with something called our trusted reviewers. So we're starting with our day opportunities, and we have the Community Action Network has recruited 2 trusted reviewers for us, and they're starting to work with people to in terms of individuals, asking them what they're interested in. If they were to have a different day opportunity, if they wanted to have different services, what they might look like out in the community. So we're starting to try and build some commissioning data and really find out what people want. So much more about place-based commissioning, much more about what do you want that's perhaps more localized in your community that actually you might want to access in the longer term. We'll start to build that data. We're starting to build that data already. We've had about 100 conversations already with people that are accessing day opportunities. We then feed that into the community catalyst worker, who will then start to engage with, perhaps it might be a domiciliary care worker that might want to build their own local service. It might be other services that already exist but are quite small and want to develop a bit more. So that's kind of where we are at the moment, building that intelligence. We'll recruit the worker, and we're doing that right now. We're just about to go out to advert, and then we'll really start to work with that worker, hopefully from sort of January onwards, starting to really engage with the providers, and we'll have a much better understanding of what sort of services that we'll be looking to develop. And then sort of by March, hopefully we'll start to be able to see how many services and how many people are starting to engage and wanting to really develop those services and become small businesses.
Okay, thank you. So coming back to Councillor Moriarty's point, if the committee were content to take those 2 suggested items first, I think what we're really saying is that there would then be an opportunity to pick up that particular issue after that. That timing seems to work from what you've described. Are you happy with that? I'll come back to you in a minute, Jo.
Yeah, thank you. I suppose I would like to just be able to kind of scrutinise at the earliest possible stage, so that decisions aren't kind of already made, and then we have very limited kind of impact, really. So that would be my ask, really. Thanks.
I think we could probably find a way of doing that, given what you've described in terms of the timetable.
Yeah, yes, I agree. I think there'll still be plenty of scope to influence at that point, but influence with some data behind it and some evidence about what people's needs are, because this is all about responding to people's needs. I can see that Betty's got a hand up as well. So Patrick, I don't know if you can see her on the screen.
Sorry, Betty, I can't see your hand from where I'm sitting, but thank you.
Yeah, no, don't worry. I think that was a really good, valid point from the last member. What I would just like to say is the adult social care transformation transformation plan is very structured, and members will recall that Phil and I talked a lot about that at one of the recent committees, one of the recent ONSs, and kind of went through some of the detail around where it originated from and why. Where we're at now is we're at the 4 key stages that we've just outlined, and the self-directed support is one of those 4 key stages. And if you look at slide 7 on the pack, because I understand the anxiety around, making sure that we are commissioning the right services, and whether things are in-house or outsourced, and all of that is really, really important. But I think where we're trying to get to with each of the work streams is create that real structure that encompasses the whole of the adult social care transformation plan, that looks at what good looks like and best practice, that also is co-produced. That is the key thing, and co-producing it is with those individuals with lived experience, but also with others such as members and staff, bringing all of our staff. And I think each of the work streams, I know each of the work streams will have a senior reporting officer. I'm the one for the work stream, which is how we work, and there'll be 3 other SROs for each of the other work streams, and it would be really, really good for them to come back to committee to be able to report on each of the work streams at whatever period during that members feel is really appropriate. We will really welcome the the involvement and the kind of overview and scrutiny provided by members. But it is a programme that has some longevity because we need to get it right and we need to embed it. And this is about a culture change as much as a practice-based change, and enabling people to have the offer that promotes their health and their overall well-being and empowers them to be at the centre of what is happening to them and what we're able to support them with. Hopefully that helps a little bit. Thank you, Chair.
No, thank you, Betty. That's helpful. Councillor Salmon.
Yeah, I might have missed it, but I haven't got my head around the 3.5 million saving. I think it would just help me understand what that was kind of per patient and what kind of percentage of saving is that. You know, is this a budget of 500 million, which we're trying to knock 3.5 million off a year, or is it a budget of 4 million we're trying to knock 3.5 off? I think those are two different things. Or have I understood the end goal entirely?
It's a good question. I'm going to ask you if she can explain the numbers.
I can. If we're coming on after this item to present on our budget as part of your consideration of budget scrutiny, we've actually included in that some slides that are specifically about transformation. So if the chair will permit me, if I could put off answering that question until we've got that in front of us, because we're going to talk, you know, big picture about the adult social care budget, and you'll be able to then see those savings in that context. If that's all right, Councillor Salmon.
It's thank you, Joe. It's a good point. And once we've heard the budget presentation, we'll then be looking at the working group and what issues we might want to look at within the working group. So you know, it's something that we could come back to once we've heard that presentation. So go on. Yeah, sorry.
And then just one more tiny thing. I'm just curious, has this been done before? You know, are we looking at following a tried and tested, oh yeah, loads of local authorities have done this, they've brought down the cost of this kind of healthcare, and they've done it doing just what we propose to do? Or is this some lovely new innovative thinking that we're about to implement?
Let me start in answering that, and then I'll ask Betty if she's got anything further to add as well. The whole of the transformation programme is built on advice that we've taken from the LGA and work they do about the use of resources in adult social care, and it's drawn on lots of experience from lots of local authorities. The very clear advice that we've absolutely taken in this is that you can make change in adult social care, and you can take cost out by transforming your services, but you have to do it over time. Hence, it's a 3 to 5 year programme. We've got a sort of 4-year period, and you have to invest in your services in order to be able to transform and to save. So that's the absolutely key message and advice that we've taken. But Betty, have you got anything further you want to add?
Yeah, no, thank you. So just on that, it is a longer term plan. And Councillor Simon, just to answer your question, a lot of councils in a lot of areas have done some of what we're doing. And if I'm being totally honest, we've done some of it, but not at the scale that we need to do it, and maybe not building in all of the factors that we need to build in. So an example, within one of the work streams, a big key part of that will be around digital, you know, how we work. It'll be around what's our digital offer, what are our residents able to access, and how easy is it for them to access. Some areas have done that really, really well, but they might not have gotten onto one of the other work areas that we're going to look at. So I'm not aware off the top of my head of anywhere that's done the whole combined 4, but I'm certainly aware of areas that have done, you know, 1 or 2 or maybe 3 of them, but to what extent it varies depending on where you're looking. What we're doing is we're saying this is a real opportunity after having the LGA come into us over, I think it was about nearly a year ago, coming up to a year, last November, when we asked them in to look at our demand, to look at how much we were spending, to look at where we might be able to make some changes. And based on that, and knowing where we want to go and the kind of services we want to be able to deliver to our residents, but also how we enable them to access what they need to access and how they want to be able to do it. We were able to pull together a program, and we spent a lot of time on the program. Phil and I talked you through it in real detail. I think it was about 2 committees ago, and this is what we believe we can bring together, but it is critical that it's done over that period of time and that it isn't rushed, because it needs to be sustainable and it needs to be embedded so that the change is permanent. So I guess what I'm saying is some councils have, but I'm not aware of anybody's done the whole collective 4 areas. And we have done some of these, but we just need to do more. Thank you, Chair.
No, thank you, Charlotte. I'm having difficulty seeing hands, so I just wanted to check you're okay with that.
Yeah, I suppose just about, I did put my hand up and then brought it down, so I think Betty covered it probably adequately. But just, I suppose, from a commissioning point of view, is to say that from a self-directed support, we have been doing a lot of checking with lots of local councils. If we look at the community catalyst, Somerset are one of the leading lights for community catalysts, and we spent a lot of time looking at their good practice and lots of others. So we have done a lot of testing with our colleagues in local councils, looking at good practice and really seeing the impact. And as I say, somewhere like Somerset's had probably about 5-6 years now to be able to start to measure that impact. So we have really tried to look at that good practice and really embed it before we've pursued some of this activity. So that's just really building on kind of the evidence that Betty was talking about.
Okay, thank you. Okay with that. Thank you very much. So just coming back to the idea, the proposals, the suggestion that we try and diary in a series of sessions over the next 18 months. We'll start on the 4th of November. We'll make a start with the 2 items that are listed on the paper, and then hopefully in the early part of the new year, we might be able to look at the self-directed support issue. Is that everybody content with that as a way forward? Okay, well, thank you very much. Is anything else anybody wants to raise on that? Otherwise, I'm going to move on to item 7. Okay, thank you very much indeed. So, sorry, I'm so sorry, Lindsay, I just can't see hands.
No problem, Chair. I just wanted to say that obviously we are now constructing your work programme for the next couple of years. This isn't plotted in anywhere beyond what you've already mentioned. Would you like to reserve capacity across your work programme every meeting or every other meeting? Obviously that can be released if there isn't a timely point to report into you, but it's clearly an important area for the committee to include, and I'm just mindful that you want to ensure you do have capacity.
Actually, that sounds like a really good suggestion. Thank you. So if we work on the basis that we will do exactly that, that will give us the opportunity, won't it, to see if we can find some additional time to look at those issues. Thanks, Lindsay. That's great. Everybody content with that? Thank you very much. Okay, thank you. So item 7 is the adult social care budget presentation, and we've got both Gillian and Sam Crow here. So Gillian, are you going to start? Sorry, Lindsay, I can neither hear nor see you properly, but apart from that, we're doing okay.
No problem.
I can't see you at all now, but go on.
Thanks, Chair. I just wanted to give a quick overview, and I've delivered the same to all the overview and scrutiny committees. So apologies if some of you have heard this already. Just to set this in context, so this is a wider programme of budget scrutiny engagement that is being set for this year. It's a newer approach from what we've done before in this council. This is stage 2 of a 9-stage programme of opportunity to engage in that developing budget. In this stage, as Gillian mentioned earlier, this is about getting a really good understanding of the budget at directorate level. And I think you're going to have 2 presentations tonight to give you that good understanding. And then the following item on your agenda will be about the opportunity to select a working group to do a deep dive into some critical budget areas. So I just wanted to flag to you that, bearing in mind throughout this presentation, any areas that you feel are really relevant for picking up in those working groups, and really to have a laser focus on the critical areas, because less is more is going to be the approach that's going to work best in those working groups. Thank you.
Oh, thank you, Lindsay. That's helpful, and apologies for my failure to recognise you. But Gillian, do you want to start?
Thank you, Chair. And I've put up some slides in the background, which hopefully people can see either on the big screen or on their own screens, and we can share these afterwards as well if people want to look at them in greater detail ahead of the working group. So I'm going to start by presenting an overview of the Wellbeing Directorate, and then we'll go into the detail of adult social care, and then Sam is going to talk with a separate presentation about public health, because we wanted to give you the full picture. So an overview of what is the Wellbeing Directorate to start with. The Wellbeing Directorate includes adult social care and adult social care commissioning, the 2 parts of that whole. As you know, Phil Hornsby retired from the Director of Commissioning role just before the summer and came along to the committee's last meeting. We have appointed one of the heads of service to stand up in interim into that role, and Zena will be starting soon, and you will get to see her more as we go through this work. Housing and Communities is also part of the Wellbeing Directorate under Kelly Dean, and then Public Health with Sam as Director for the Shared Service Public Health Dorset. So the wellbeing budget as a whole, and this is the first time that I've presented it to you, including the public health budget in this way, and we've chosen to bring a public health budget to you as well, because, as you'll know, we're working towards into next year moving from the shared service into having our own integrated public health function, and Sam will talk more about what that means from the financial point of view. The largest part of this, of course, is the adult social care budget. Both adult social care and the commissioning budget goes on our adult social care services, and you know that, because you know that it's a large percentage of the council's budget overall as well. So of course, but that's really visible here. Oh, and I should have mentioned there, Housing and Communities is also part of the budget here. Housing and Communities budget, in terms of scrutiny, reports from a housing point of view into Environment and Place, and Communities into the Overview and Scrutiny Board. And I can say a bit about what Environment and Place decided to do with housing in particular, if the committee is interested later. So moving into the adult social care portion of the budget, what you can see is within that large budget, the largest part of it goes on the cost of care. So the spending that we make into the cost of care for people with long-term conditions, 47% of that pot, 115.4 million, and the cost of care for people with learning disability and mental health at 73 million. So those are the largest chunks of the budget. Quite a significant percentage on Tricuro, who provide some important services for us. And the committee will be aware, we talked about this last time as well, that's a budget that has reduced in consequence of some of the changes that we've made to day services, and also we're asking Tricuro to kind of rebalance some of that spending, and that's an area that I know the committee is interested in. And then smaller proportions on other really core parts of our statutory services in terms of care assessment, safeguarding, and then some other specific services too, including support to carers. And we can talk about these in more detail if the committee is interested, or if there are particular areas that you want to deep dive into as part of working group. I wanted to specifically mention that something that Cabinet has taken a decision around, which is to approve a reduction in the adult social care budget by 5.1 million, and for those funds to be redirected to support the cost of children's social care. That's something that was decided at the last Cabinet meeting. What I've included in the slides is the explanation for why that decision was put forward and was taken. The care budget is a demand-led budget. It's a very significant demand-led budget, and it's not easy to forecast exactly at what level it will land at the end of the year. It's something that Betty and her team work very, very carefully on, both in the planning and in the management of the budget. And also we're often taking steps, we have been through this year, we will be with our transformation work, to try and achieve savings through those budgets. So that's another reason why it's difficult to land exactly what's the right amount and where will it land. And what you can see on the slides is the variances that occurred in the last financial year. In the third quarter, we were forecasting a variance of around 4 million, and by the fourth quarter, that had increased quite significantly to just over 10 million. So that change in variance was about 5 million pounds. And so based on that variance and that outturn, the decision that's been taken is to move that funding across into children's social care on the basis that it wasn't in the end, it was forecast to be needed and it wasn't in the end needed. And we can explain a little bit more about that if that's helpful. But that's the basis for it, and it's just managing the budget pressures to where they need to go. Looking ahead into where we are now, or where we were just before the summer at the end of quarter one, what this shows is that adult social care was moderately underspending, and commissioning services the same. And if I move on to the next slide with the rest of the wellbeing budget, because we manage it all as a whole, a few pressures in there, but in the round, the wellbeing budget as at the end of the first quarter of this year was pretty much balanced. When we're coming now to the end of the second quarter of the financial year, and we're starting to see some pressures emerging against that, and that's something we'll be looking at very closely in the coming weeks as those details are finalised. And that decision to move £5 million across obviously has given us less headroom to manage within. But my view on it is that we should be managing. This is one of the largest budgets in the council. We should be managing it as tightly as we can, while continuing to provide the services that we need to and to meet our statutory duties around it. Moving on to the next slide, what this shows is how we build in pressures into the MTFP for the period ahead. One of the things I will draw out is that, of course, one of the pressures on the costs of our commissioned care is the national living wage. And we try to make some assumptions every year on what that will be, because under our commissioned contracts, we're required to pay the national living wage, and rightly so. If that's something that staff are entitled to, that's something we need to make sure is passed on. But it can be quite a significant cost, and we won't know what percentage is set at until, I think it's something that will be set in the budget, which is coming up at the end of October. So those figures may change, and so the headline figures on our budget are adjusted around that. My next slide. What this slide shows is our transformation savings, and it starts to answer the question that Councillor Salmon asked about the 3.5 million. Sorry, my own eyesight is struggling with my own screen. So adult social care transformation savings are down on the second half of the slide there, and what you can see is a build up of savings year on year and through the period, which slightly beyond the MTFP will add up to the 3.5 million year on year. But for 25-26, we're forecasting 1.3 million, followed by sort of a further 1 million and a further 1 million when you combine the transformation programme alongside care technology, which is a programme we already had in place. So it's that level of savings off the very significant size of the cost of care budget that I presented at the beginning, and combined with the fact that we add additional on for pressures like demographic growth and like the national living wage and those changes. So a simpler way to answer the question, it's a relatively small sum off a very significant budget, and one where the top level of the budget moves over time. So tracking those savings and showing the benefits being realised is one of the real challenges of the programme, and perhaps something that we might get into in the piece of work around data. Briefly a bit further on the transformation programme, obviously council having agreed that we could have some investment into this programme, that's a budget that we're managing very, very tightly, and we'll be reporting on in the cabinet meeting in January, and that might be something that Scrutiny looks at ahead of that meeting. Significant amount of the investment goes into the How We Work programme. Again, the project that's furthest ahead and that we're recommending that you take a look at, but also some significant investment into self-directed support, and those funds pay for the staff that Siobhan was talking about and who are coming on into the team shortly. So final slide here, this is just a little bit more detail on exactly how all of that money is being saved, and we are taking a great deal of care to ensure that all of those resources that are dedicated to transformation do go into the transformation work and not into business as usual, because that's extremely important. So I'm going to stop with that overview. But Betty, is there anything that you want to add for members before Patrick opens it up for questions? Anything I've missed?
Yeah, no, I think you've covered it. I think you've covered it well, but I think it might just be relevant to add on the 5.1 million that was feared over into children's. When the budget was set and that was factored in, it was set on assumptions that were very, very feasibly would happen, that were very feasible that they would happen. For instance, when you look particularly in areas such as learning disability, mental health and autism, there was a budget set against a number of individuals, and obviously I don't want to go into any confidential information around specific cases, but around a number of particular areas of where it was expected that some people would need more in that financial year, but the circumstances may have changed, or the bespoke care offer or the bespoke need that they may have been pushed back a year or so. So I don't want members to have a kind of view that the budget was set with an overly ambitious target of having more money that wasn't necessarily based on real true assumptions. That's absolutely not the case, and it may well be, as Gillian alluded to, we're beginning to see that things are a little bit tighter in quarter two, coming at the end of quarter two, and it may well be that in a year or two we need to go and we may need to look at rebasing again, depending on what happens with individuals that we know. And that's something that we constantly will be keeping a close eye on and monitoring very closely. Thank you.
Thank you, Betty. Just take some questions just to bottom out Councillor Salmon's point. So as set out in those slides, there was an illustration of how that 3.5 million savings was going to be achieved. That's in those slides. The thing that changed when it went through cabinet was originally the plan was to invest 2.9 million, and that is still the intention, but the plan was changed slightly in that they were just going to invest 1.79 million initially and then review it after 12 months. So it was just I think trying to be even-handed. Ceci, looking at Councillor Brown, that they were wanting just to check that the system was going according to plan before they released the rest of the money. So anyway, I hope that answers that question, Joe. But did you have another point? Sorry.
Yeah, so I just wanted to check. So that sounds like the wellbeing budget is £120 million a year, and we're going to save at the end of the 6 years £3 million off that. Have I got that right, or have I misread the figure?
Apologies, you've got that right.
Councillor Gillett.
It's £3.6 million in total, not as a annual saving.
Annualised recurring. But against a budget that grows in line with demand and grows in line with costs, that's why it's about achieving a kind of a sustainable baseline, a sustainable reduction against that demand increasing.
So I'm just on the first slide in the lovely little pie chart. Commissioning takes up 15% of the wellbeing expenditure. I just wanted to check that is just money spent internally running the commissioning within the council, and then that 68% of adult social care, that is going to be money spent for the majority on commissioned services. Am I understanding that correctly?
It's two different ways of cutting the budget. So the first pie chart is showing essentially adult social care is the budgets that sit under Betty and her directorate, and the other budget, the commissioning budget, is the budget lines that sit under the commissioning team. Some aspects of which are the team itself, but it also includes the tricural budget. So when you come onto the other pie chart, it takes the adult social care and commissioning team budgets and cuts them in a different way against services. So it's two slightly different ways of looking at the funds.
Go on, Joe.
So I think, and I might be wrong, I might have misunderstood something earlier, but with children's services, one of the big problems is how we are taken to the cleaners by the private providers. And I think the transformation work that is going on there is potentially looking at bringing some stuff back in-house. If nothing else, doing the kind of back of an envelope calculations of, if we brought this stuff back in-house, how much money would we save? And I'm just curious, prior to this plan being developed, which sounds like it is, utterly integral to it, is the use of micro providers and third-party providers and all of that, was there any consideration of going in a different direction and going, I tell you what, we take the risk already. If the minimum wage goes up, we've got to pay those staff extra. The businesses don't take that risk. We take that hit. There are all the inefficiencies of commissioning it. Do we just bring a lot more stuff in-house? Was that looked at all as part of this transformation programme?
That's not been the approach that we've taken to transformation here. I mean, there are some similarities between adults and children's, and again, Betty might want to say more about this, but the dynamics aren't completely the same in terms of the markets, and I think our the direction that we've taken and the priorities that we've looked at, we haven't explored bringing things in-house as a way of delivering those savings. But Betty, do you want to add anything from that point of view?
Yeah, I think just to add on what Gillian has said, we haven't considered it in any great detail, but what we do know is that within adults we commission with a large number of providers, So it's important to really understand how many providers are offering service to us. For instance, we've got a large number of domiciliary care providers. We've got a large number of residential homes. We could never take all of those in-house. If we were even thinking about that, which we didn't, as Gillian said, we didn't consider that. That would be over a long, long period of time, and you'd need to have the space in the buildings to be able to accommodate that. What we have considered within this, and particularly under work stream 3, whenever Siobhan was talking earlier about self-directed support, what we have looked at is those services that we do commission, and those services that are particularly within our long arm trading company, Tricuro, such as reablement and such as some of our bed-based provisions that we have that are managed and run by Tricuro for us, is around how can we better get best use out of those and work with Tricuro to really help us maximise the full potential within that. But also, as well as that, and as part of the day opportunities review, we really considered where our gaps were, and that was some of the stuff that Siobhan was talking about. But I think it's really important to have in your mind how many providers we use within adults. We use specific providers for learning disabilities, for mental health, for working with individuals with autism, and then we have long-term conditions that could be a wide range, and we have substance abuse. We don't have capacity to have them all placed in one space, and the number of residential homes as well. But I do think it is something around how are we being really efficient with what we're using, and how are we getting best value for what we're commissioning, and how do we really, really track that. Part of this programme will be about looking at that and really monitoring that very closely. I hope that's helpful. Thank you, Chair.
Thank you, Betty. Before I bring David in, Councillor Allen, was your point on the same thread, as it were?
Yes and no. I just wanted to pick up on the 5 million that you've handed over. I know we're talking about very large amounts of money here, and we're talking about relatively small amounts of savings around transformation. But are we confident? I know Betty, you said it was specifically earmarked for some individuals and that things change. But are we confident that we are actually delivering the care packages that people need, mental health services that people need, before we hand over £5 million to children's care? I'm not saying that that's not something we need to be providing in this council, but I'm sitting on health and adult social care, and I just want to be sure that we're not passing money over that actually we should be delivering services with. Thank you.
No, thanks, Councillor Allen. I did make the point to Councillor Cox at Cabinet that I could spend £5 million quite easily on adult social care, but he didn't seem terribly enthusiastic about the idea. So, Councillor Brown, I apologise. Thank you.
Yeah, thank you for letting me come in and speak. I just wanted to pick up a point that Councillor Salmon made about comparing with the children's social care and the pressures that are there, and the talk of sort of certain providers profiteering. I think, and probably Phil Hornsby would probably, he's said to me a lot of times, and he'd probably say if he was here, that I think there are similarities between children's care and adult social care, but one of the fundamental differences, I think, in this area is that in adult social care we are actually quite a major player in the market, so we actually have quite an influence over the market, and that's intentional. And I know, going back to days of Poole Council, that we own a number of the care homes that we then lease to other operators. We built our own care home in Camford Heath, Vigbury Lodge, which is operated on our behalf by Shaw Healthcare. We have Tricuro, our local authority trading company, operate day centres, reablement services, and care homes as well. So actually, we're not in a position where care homes in the area could profiteer or rip us off, or sort of charge a lot, because we would walk away, because we have our own provision and we actually can influence the market because of the amount of business we put in the market and the block beds that we have and our own operations. So I think as we're a player in the local market, I certainly have not seen anything about in adult social care about profiteering or about charging us rates that we can't. We actually have a very strong sort of negotiating position in terms of our commissioning on adult social care. So for me, that's one of the fundamental differences between adult social care and children's social care.
Thank you, David. Betty, did you want to say anything in response to Councillor Harlan's question about are we confident that services won't suffer? I think it's my very clumsy paraphrasing of Councillor Allen's erudite question.
So if I firstly just add, if I may, Chair, please, just to what David said around the influence in the market, I think it's also really important, Councillor Salmon as well, just for me to reinforce that we are part of a health and social care system, and collectively as a health and social care system, we are a major player in the market. So that makes us even stronger whenever we're doing it in a much more integrated way. And some of the beds that we commission are for the system as well. So, that's probably quite a significant difference when you look at adults to children as well, just adding to that influence. And then just going back to Councillor Allen, that's a really difficult question to answer, in that I don't think that we can ever truly say that we are giving everybody every single thing that they would like us to give them. And I think that is something that we're always going to have to monitor and keep under review. I think when we're setting our budgets and looking at where we have a demand growth, where we have demand in growth, or where we have a spike, or where we know that we have something that we need to flag, because there may not be enough money within the allocation of the budget, we will continue to do that. It is difficult in some of the areas, especially the real complex areas that we have within adults, to really tangibly predict what the cost might be or what the fallout of a change to what's currently available might have on our overall ability to stay within budget, but also to provide those individuals with particularly real bespoke packages of care or environments that they need. It might take us a little bit of time to be able to work that up and to train people, and also to get building base that are able to do that. And that might take longer than what we would like. Sometimes we will wait up to a year for particular accommodation type, for particular bespoke. I'm talking about real high level complex, which is very few in numbers, but really, really intense in what's needed. So can I intangibly say that 5 million, I will not need that again? Or the answer is no, I can't, and I don't think anybody can. But what I can say is, at the time of the year-end and budget, some of what we predicted as assumptions to come through did not come through, and that's what it resulted in. And some of the cost in those real high complex areas, that can be 3 people. That could be, that amount of money, depending on what the high levels of complexity is. It's really important to hold that information in your mind as well. We may not be talking about 100 people or 50 people. We could be talking about a handful of people that would equal up to that 5 million, and they will come at some point. But right now, within the council, it's important that we balance where that need was greater at the time. Thank you, Chair.
Oh, thank you, Betty. Councillor on?
I just want to make a sort of comment, really, is that I don't know about my councillor colleagues, but I hear about lots of residents that end up in care homes because they can't get help at home, families that want to have their loved ones at home and be cared for at home, but end up in long-term care, which is not right for them. And I know that some of your transformations hopefully looking at that. But I'm not talking about those complex cases. I'm talking about the basic care that people need today. And I'm just can't say I'm awfully happy that we've given up any of our budget. But there you go. That's just my view. Thank you.
Yeah, well, it's a good point, Council. Nobody asked ours, did they? But there you go. Anne-Marie.
Thank you. I'm afraid I'm going to echo a little bit. I do apologise. You've got everybody, but it's a lot of money. I'm just wondering, do we have the data to say whether or not we're actually fulfilling all our statutory obligations in terms of carers assessments, respite care, all of the other statutory requirements that we're diagnostics for adults with kind of on the spectrum, are they all being done in a timely enough manner for us to be giving that kind of money away? I suppose would be, sorry, I am echoing what everybody.
I'm going to suggest that Betty comes in and she can give you from the operational perspective.
Could do that through the chair, I guess.
Apologies, Chair.
Councillor Salmon.
So I just wanted to, it's lovely that the market is nice and kind and friendly and we're not being taken to the cleaners, and all of that, which is good. But I'm just trying to get my head around what's on the table here. So the plan is we're going to save 3 million over 6 years, so annually we'll save £3 million off that budget. But that budget is a budget that's constantly growing. And actually that variance of growth or our forecasting was out by £10 million in Q4 of 23-24. Am I reading that right? That we spent £10 million more or less than we were expecting to. So it sounds like there's quite a lot of variance here, and actually the rate at which these things can change is greater than the forecast savings at the moment. Is that right?
That's as I understand it. Betty, apologies. Could you cover those 2 points, do you think?
Yeah, so if I come back to the first point, Chair, is that okay that Councillor Allen and a further councillor commented on? I think this might be an opportunity for committee to look at, whenever we're talking about which areas you want to specifically look at, and maybe have a working group. Lindsay mentioned it at the beginning, whenever she was putting some context to around the budget setting, and then what key areas you might want to really do a bit of a deep dive into. It might be based on the conversations that's taken place. That might be an area where to explore this a little bit further around those waiting for care, how long it's taken people to kind of get reviews, and maybe look at it in that context. And what I would say, just back on the two previous councillors, we absolutely have not got to everybody who has put in a request for care. We have people that have come to us for assessments that are waiting for their assessment. They might have come to us a week ago or 2 weeks ago and we haven't got to them. We absolutely have people who are waiting for reviews, and we will have people that are waiting longer than what we would like them to be waiting and what they would like to be waiting. What we do is we risk assess around that to make sure that there is a risk assessment, and we do tell people that absolutely, if their needs have changed, to come and tell us based on when we did the risk assessment. So I think that might be an opportunity whenever we get onto that bit to have those particular areas maybe in your minds whenever you're thinking of the key areas that you might want to do a bit of a deep dive into, because most of the spend in adult care goes on service provision. Operationally it goes on services. The high majority of the budget goes on care, and therefore the care it's important to look at those people that we haven't got to yet, but equally look at maybe how much care people are getting. We know that the LGA, under the use of resources, told us some really key facts and looked at us compared to nationally and then within the Southwest. And that might be something that we could bring into whatever area members decide to do a bit of a deep dive on, if that helps. And then, Chair, there was the comment from Councillor Salmon. Can you just remind me of what that was,
Yes,
please, Councillor?
This was about the 10 million really, and the variance of how it comes to be that we have such a degree of variance. Is that accurate, Chair?
Yeah, so I touched on some of that around that there could be an expectation that things had come and then they hadn't. I think also we may have generated more income. Then that's where some of the 10 million came from, because we did a bit of a report around how we arrived at that variance. Some of it was because we had a higher demand and we were getting to more people, so our contributions, our income was higher. It may also be that cases that we were individual cases and care costs that we were funding, they may have transferred over into health because of their needs changing, and they fell under the category of having a primary health need, which others will probably know as continuing healthcare. And it may also have been because where we were fully funding, we entered into a joint funding agreement with colleagues, our health colleagues. So there's variable reasons. And we have all of those because we reported all of those reasons and put amounts of that 10 million by each of those areas to show. So if members wanted that again, we could easily have that circulated, and that would give, I know it was Councillor Salmon that raised it, that would give you a very clear breakdown of how that 10 million variance took place. Thank you, Chair.
Thank you. Would it be okay with everyone if we now pause that aspect of the discussion and ask Sam if you would give us a presentation on the public health side of things, please?
Thank you, Chair. Good evening, committee. I'll just share my screen. Hopefully this will work. Right, that's showing for you all now. So I'm just going to show about 7 slides this evening, and we've taken the step this year to develop a single presentation which has gone to both councils, because we're in an unusual position this year, having had notice given on the shared service. This is the last year of the shared service budget. So I'll cover some background to the public health grant in the 2 councils, the contribution that makes towards the shared service, and then I'll walk you through where we've got to so far in the work on disaggregation, which is the disaggregation of the cost in the shared service, not the budget, if that makes sense. So I'll help you out with that when we get into the introductory slides. Okay, so just some basics really. Both councils, Dorset Council and BCP Council, gets a ring-fenced public health grant. So that's got a grant that's given to the councils. It arrives from MHCLG, but it's Department of Health and Social Care money. And because of that, it comes with a number of conditions on it. So every year we get a letter. We have to basically assure that it's being used for the provision of primarily public health services. And because we've been in a shared service arrangement ever since 2013, we're in a long-standing agreement where both councils pass most of their grant to the shared service, which is known as Public Health Dorset, and that's the service I'm director of. Each council also keeps back some of its grant to use within the council. So you're allowed to do that as long as you can justify there's a clear purpose for where that money is being used to improve public health outcomes. And I'll walk you through how some of the grants used in BCP Council. I've mentioned that there's a sign-off process. So Department of Health and Social Care asked myself and Adam Richens as Section 151 and Aidan Dunn in Dorset Council to sign off that the whole of the grant has been used within the grant conditions in each council. And until this year, we would monitor that budget and the spend against that budget in a public shared cabinet called the Joint Public Health Board. Because we've given notice on the shared service, the Joint Public Health Board is no longer meeting, and instead the budget's being monitored through what's called the Programme Delivery Board. So this is a group that's been established to oversee the disaggregation of the shared service. And obviously we report into both cabinets as well. This table just shows you where we are on the 24-25 forecast. I'll sort of walk you through it fairly quickly, but I'm not intending to do a huge amount of detail on this. The first two lines you can see are the contributions to the shared service budget from both councils. So the first line shows that BCP Council contributes 12.48 million, Dorset Council 13.48 million. But what you need to take into account is that we don't commission the same range of services in the shared service. So we additionally commission drug and alcohol services, but for Dorset Council residents only. So when we start to look at the budget areas, that first line under the heading budget areas, the 3 million is the cost of commissioning drug and alcohol services for the Dorset Council residents only. And that's important, so remember that. And then we've got our major contracts, which are for public health services. So the first one, early intervention, 11.4 million, give or take. That's a huge service commissioned through Dorset Healthcare, which provides all of the health visiting and school nursing support across the whole of the county. Similarly, we've got a line in there for SH clinical services, that's Centre for Sexual Health. That 6 million, again, it's through Dorset Healthcare, and that provides access, open access to sexual health services, again, across the whole of the county. You'll also see lines in there for the public health team costs. That's the whole of the team costs. So it also includes all of the overheads, all of the pension costs. It's the full cost of the current team within the public health shared service. And then there's a number of smaller contracts which cover the work that we do around health protection, public health intelligence, so on and so forth, and inequalities. But those are the main areas of our spend, if you like. And then you can see as you go across the table, we've shown you where we were actually in terms of our spend. And in terms of our forecast, important to note that we're anticipating at the moment to be overspent by about 212,000. I'm not concerned. We've never overspent, I think, apart from 1 year where we overspent by 30,000. Usually, because we've got some cost and volume contracts which vary through the year, we recover that as the year progresses. So we don't change the budget to match the actual spend, but we use that flexibility in the budget, and that 212,000 will be made up through the year. We'll probably come in round about zero. So I'm not concerned about that overspend at the moment, but we are forecasting overspend currently. So I'm going to talk a little bit about how we get to 25-26 and the opening budget in each of the two councils, because effectively, in the simplest terms, what's happening is we're taking the cost that's been invested in the shared service and returning it to the two councils. So from April the 1st, 25-26, you should be able to see a public health budget in each of the two councils that reflects the work of the disaggregation and hopefully won't cost any more than it does currently. That's the aim of the game. So we've been going through a process which is being overseen by a strategic steering group. That's myself, Gillian Kay and Aidan Dunn as the sort of three senior officers overseeing the programme. That group's responsible for taking some of the key decisions around the approach to disaggregation. The decision about how we split the service is a decision for the heads of paid service of each council. So over the summer, we developed a series of options about how we would do this and what disaggregation actually means. Both council chief executives supported our recommendation to go with something that effectively looks like a full separation. In effect, that means that each council will have a separate public health team on the 1st of April under a new Director of Public Health for each of the two councils. The Health Improvement Service Live Well Dorset, which is an integrated behaviour change service, which costs about 1.2 million. We've agreed that that will remain a joint service across both council areas, but hosted by Dorset Council. All of the other contracts that I've just run through in that table, we've agreed no change until we get to their natural contract expiry period, and then we review that on a case-by-case basis in line with the procurement timetable. So those big contracts around health visiting, for example, when we come to the point of expiry, we start to do the work together to understand whether it's better to split that out and to go our separate ways with a separate service under each council, or whether it makes sense to continue to commission them jointly. So effectively, I'd think of all of that work as it's a bit like a phase 2, if you like, after April. But it means we can get the main work done on splitting the team, splitting the responsibilities, and recruiting 2 directors of public health by the 1st of April. So until we've made decisions on those contracts, Dorset Council will hold those contracts on behalf of both councils because they are the legal entity. The contracts are all in Dorset Council's name, but there will be a continuing work programme to make sure that we're getting the right type of value, if you like, for the arrangements that are in place. In terms of the budget proposal, what we agreed on the 20th of September at the steering group was that we will use a financial ratio 55% BCP Council to 45% Dorset Council to guide the decision about how we split out the cost in the shared service. So if you take the example of developing a separate public health team, we take the whole of the team costs currently experienced by the Public Health Dorset service. 55% of that cost would be picked up by BCP Council on the 1st of April and 45% on Dorset Council. And that's because when you look at the percentage contribution that each council makes into the shared service, when you take out that additional 3 million that's used to commission drug and alcohol services for Dorset Council residents only, that's the proportion that remains. It's done in a 55%, 45% basis. So in simple terms, although this won't work out necessarily straightforwardly, if you think of our current public health team, which probably has about roughly 50 headcount, by the time we've gone through and applied a 55% proportion, you'd see about 55% of the team moving to BCP Council and 45% remaining with Dorset Council. In budget terms, that's around about 1.7 million for BCP Council and 1.4 for Dorset Council. So it gives you an idea of the process that we're using to work through all of those costs. So the remaining BCP Council budget in 25-26 will reflect the 55% share of all of those other contracts that I mentioned. So we're not disaggregating health visiting, but we'd still receive 55% of the cost of that contract after April to pay for that service until such time as we've renewed the contract. Hope that makes sense. For the cost and volume contracts, these are generally smaller contracts that pay our GP and pharmacy providers. Each council is going to pay their own share based on the activity encountered in the next year. So we've got a very clear process of measuring that and accounting for it. There is some further work that we need to do. Any other implications to consider about how we land the Live Well Dorset budget properly? There are some additional activities that the public health team provides in and around that service which haven't been explicitly costed. We need to look at the historic activity in both councils and make sure that we've got a good view of the value that that spend is delivering for each of the councils, and develop a clearer approach to commissioning that service in 25-26 so that you can be assured that you're getting value for money. There's a balancing figure, which is the way that we do the accounts in Dorset Council, particularly because of those cost and volume budget lines that experience quite a lot of variation in year. And we've agreed with Section 151 officer in BCP Council to show that as a savings target this year. So there'll be a Dorset Council share and a BCP Council share, but that's part of us coming in on budget. If you remember, I showed you that column where we're 212 overspent. The balancing figure appears in there as a savings target that we need to make this year. And then there's a couple of smaller issues about technical aspects of calculating back pay for pensions, which please don't ask me to explain that, but it's in good hands. So these are historic pension contribution shortfalls. We need to understand what the BCP Council liability is around that when the staff transfer. And then we've got some very small non-contract spend areas, including some additional overheads, which we're working through on a line-by-line basis. So the next table shows you the implications of what I've just explained and the agreements that we've reached so far as part of the disaggregation work. You can now see the first budget line shows you the whole of the public health grant for BCP Council. This was the value of the grant in 24-25. One of the important assumptions that we're making in the process is that there will be no uplift in 25-26. And you can see the Dorset Council public health grant in its entirety. I mentioned that each council keeps some of the public health grant to use outside of the shared service. In BCP Council, that's now worth about 9.2 million. It's predominantly used to commission drugs and alcohol. That's a large slug of that money. And then there's about 3 million used in early intervention for children's services and a range of other smaller contracts, which we've agreed over time. In Dorset Council, nearly 2 million was used outside of the public health grant. The next line shows you that 3 million for the Dorset Council drug and alcohol element only, and an element for the cost of the staff. Those staff wholly work on that commissioning of that service, so they're out of scope for the transfer and disaggregation work. And that leaves, as I've said before, about 1.7 million team cost for BCP Council and 1.4 for Dorset Council. You can see the cost to BCP Council of the Liverpool Dorset service now that we've applied that disaggregation proportion, and then the cost of some of the other fixed value contracts running down the rest of the table. I've shown the savings target in there, so that's that 611, which is our balancing figure. And then there's a couple of other areas of spend which haven't yet been nailed down, but they amount to relatively small amount, around about 60,000 in total. So we've done the bulk of it. Just a final slide, just on some of the risks, the issues and the uncertainties. I mentioned the public health grant allocation. Unlike the local authority settlement, we don't get to know on Christmas Eve or whenever they normally announce the local government settlement. It's usually February or March. It's extremely late. It's not very useful in planning terms. So every year we're having to think about next year's pay awards and build that into our planning assumptions. The current assumption is that there won't be any change. We have actually had small increases in the past 3 years or so, but the average is usually around about 2%. Just to put that into context, the value of the public health grant has fallen overall in real terms by 28% since 2015. So we're not keeping pace with inflation. We're not keeping pace with technology change, population change, a whole load of pressures. But that's the same for every public health team in the country. We're no different. In terms of the staffing budget, we've always operated a vacancy factor within the shared service of about 5%. We're continuing to plan on that basis. We did factor in a pay award of around about 5% for 24-25. We don't yet know the full impact of that pay award yet because it's not been finally settled across all of the staff groups. One of the issues that I'm always concerned about is the pay awards that happen in other parts of the public sector. So you saw that the nurses rejected 5.5% yesterday. That's important because we indirectly employ a lot of NHS nurses through the health visiting school nursing service. So if they come back to the table and that pay award ends up at 8%, that'll have an impact potentially on the contract price. So it's important to understand those indirect pay awards as well. The teams in each council might not be confirmed until quite late in the process because it's not going to be straightforward. Because we're a small team, applying that proportion split may mean that there are some people that you just can't split in half. Just doesn't work like that, does it? So how that balances out and the exact cost to each council we'll know closer to late February, March, I think. And then there's a couple of other contracts which we're working through because we do receive quite a bit of income actually from NHS partners. we've been running the Treating Tobacco Dependency Programme on behalf of the trusts in Dorset for 2 or 3 years. We're likely to hand that back so that it's nice and tidy for 25-26. And we've got a couple of small contracts that have break clauses in 25-26 that we just need to wrap up. But that's pretty much the transition from our shared service budget in 24-25 to setting up with a new budget in BCP Council 25-26. Happy to take questions on any of that.
Thank you, Sam. That's really helpful. Thanks very much for that presentation. Just before I take questions, can I just check with Gillian and with you, Sam, that you're happy for us to circulate those slides after the meeting?
Yeah, absolutely.
Okay, thank you. Thank you very much. Councillor Allen.
Just very quickly, obviously this decision was made quite a while ago, so there's not a lot of point complaining about it. However, considering working across the whole county together on services with people working together is probably what I would say your ideal, and splitting things apart doesn't feel very good. So you said it's not going to cost any more, but how do you balance the staff costs if you're going to have 2 directors of public health instead of 1? How does that look? Is this going to impact services for residents, staff and joint working? Is it going to impact? Is the residents going to feel this, or will it just happen quietly in the background and they won't have an impact on it? And I'm just interested in the Live Well Dorset offer and the split, and just holding my hands up here, we use Live Well Dorset quite a lot in my day job, and I'm just interested in how you work out if they're being effective in the public health work that they're doing, and are we looking at who's accessing that from the BCP residents and the Dorset residents, so that we are getting good value for money? Thank you.
Okay, three big questions there. So I think in terms of the impact on residents from services and the working together issue, actually, although this is disaggregation and establishing 2 separate teams, I think there'll still need to be quite a lot of collaboration between the 2 teams. Without getting too technical, there is no way we could respond to something like another pandemic without working together really, really closely. So the 2 new directors of public health will, I hope, be working very, very closely together, because we can't possibly cover off all of the responsibilities from the perspective of a team that will be smaller. So there's naturally going to have to be some stuff that's shared, and particularly system working. The point about the cost of 2 directors of public health, I might invite Gillian to comment on the BCP side. I believe on the Dorset Council side, part of the increased cost of having to have a separate director of public health will be met through removal of some of the posts. So the management responsibility is likely to increase under the director of public health on the Dorset Council side. And so the salary is part paid for by savings that are made, because heads of service will go as part of that change, if that makes sense. So there's wider transformation in the council that will absorb that cost. The point about Live Well Dorset, if it's helpful, I'm pretty sure I could provide access to our dashboard for committee, which you can see council by council, all of the activity that goes through pathway by pathway, and where we've got outcome information because people have been back in touch and we've got that follow up. I can tell you that particularly in BCP Council, one of the things we're most proud of is that we do reach people living in the most deprived areas. At the moment, I think 34% of the overall contacts in BCP Council come from the 20% of areas most deprived. So we actually incentivise the team to preferentially work in those areas and to do more work with practices and community organisations to try to get people who have the highest needs into the service. So we're confident we can show that. What will be important going forward is that each council feels it can start to commission in accordance with its own population. So it could be a good thing in terms of flexibility and responsiveness. So I'm pleased that we've reached that agreement. I think it's really important.
I think that's quite a good news story, that
Can we leave that with you, Sam, to see if that's possible?
Yeah, I'll follow that up with a post-meeting note.
Thank you. Just if I could ask a question. In terms of the contracts which are being retained within Dorset, for until the termination of those contracts, are you able to give us any kind of indication about how long those contracts are for? I mean, obviously they're going to vary, but by and large, are they relatively short-term contracts, 2 or 3 years, or are some of them much longer periods?
It's a bit of a mix. So the cost and volume contracts are hard work, but we do them through a framework agreement. So that framework usually runs for about 7 or 8 years, and providers enter the framework when they're happy to be providers on the framework, as long as they meet set quality criteria. But some of them drop off as well over time. So we aim to keep that framework populated with a good range of providers. The ones that are need a lot of work are the large contracts with Dorset Healthcare. They're complex, they're high profile national public health services, and they cost a lot of money. So the work to re-tender always takes a lot of time. It's important that it's done properly. Procurement laws changed. It's changed within what are classified as health services. So we use the provider selection regime now, and there's also been changes to local authority procurement law coming in. So it is actually quite a big programme of work. So we probably need about an 18-month run up to do that work properly. So it's not a straightforward answer to your question, but we'll be taking different approaches depending on the types of contracts. For the big ones, we absolutely need working groups thinking about this probably from October onwards, so they've got enough time to take that decision properly. But some of the smaller contracts will be relatively straightforward to take decisions on and re-tender in a fairly straightforward way.
Gillian, did you want to add anything from the BCP perspective on that?
Yes, well, I should come back in on the question that was asked about Director of Public Health salary, and then I might make a couple of comments on the contracts point as well. So it's similar to in Dorset Council. As you know, and we've discussed a couple of times at Scrutiny, we are bringing together public health alongside communities, and that allows us just to flex budgets in different ways to be able to cover that additional cost. Of course, we'll need to look at the whole of the budget. As Sam says, that we won't know fully what costs are coming over to us and the budget that's coming over to us until we get closer to the end of the year, and we'll have to manage that, and one of the things that creating our own service gives us is that flexibility to make those decisions. On the contracts and sort of impact for residents, because that's what it's about at the end of the day, we have taken, and in line with the kind of steers we've had from Cabinet and in the original Cabinet decision, don't separate things for the sake of separating them. There should continue to be some sharing where that's the right thing to do, and on the contracts in particular, being really pragmatic and really almost risk averse around what we're changing, and changing things in a really, really managed way is kind of the approach that we're taking to it. But at the same time, particularly on the smaller contracts and on those larger contracts as and when they come up, that's the places where it will give us the opportunity with our own service to say, is it right for us to continue to work together at Pan Dorset? And in some services, it will continue to be our advice that that's the right thing to do, even over the longer term. And then in other areas, there might be places where we say, well, no, actually, for this council and for our priorities, we want to put more resources into this and less resources into that. And that divergence can take place in line with the council's kind of strategy and the issues that we're dealing with at the time. But we're adjusting it in a balanced way and in a pragmatic way to manage any risks around it.
Thank you very much. Are there any questions on that aspect to Anne-Marie?
Thank you. Just a couple of queries about, you say that when you disaggregate, or we disaggregate, there will be obviously staff changes. Do you anticipate, and I appreciate you don't know yet, but do you anticipate a lot of complicated negotiations in terms of different contracts? And you also mentioned about some layers of management may be going. So are we hoping for just voluntary redundancy, or is there any question that we might end up with compulsory redundancies?
We're only just getting to the point where we're agreeing an HR process, and it wouldn't be appropriate for me to comment on that because I'll be in consultation as well because my post is at risk of redundancy. I think, these processes just have to run their course, and I'm sure both councils will be doing their best to minimise any risk of cost through that process. And also, we need really good public health people. They're quite hard to recruit, they're quite hard to find. It takes a long time to get people skilled up and confident in the role. So I'd hope that this process will be run as smoothly as possible and we limit any impact on the team as much as possible.
Thank you. It was a fair question. I just think we just need to remind ourselves these are Dorset staff at the moment. Councillor Allen.
And very, very quick request going forward. I know I pointed out some of the negatives in my questions, but I think that actually we should turn that around and look at the positives. And I was just wondering if you could bring to committee over time how you see this has become a positive for our council and for our residents, because again, sorry, other hat on, but I work across Dorset on some of the services that I work on in my day job, and there's a big difference between rural Dorset and there is between our conurbation. And I'm really pleased to hear that Live Well Dorset are getting to those deprived areas, but what we've got is a very different issues around public health than we have in a rural area. So it'd be really nice to hear how this change is actually giving positive impact to our residents so that we can see it not just as a negative but also as a positive. Thank you.
Yes, I'm sure we will be wanting to come back to it at some point to see how it's all going and as you say, how it's impacting on residents. Okay, if there are no more questions, I'd like to move us on, if I may, to this issue of the scoping report. I think we've still got Lindsay online. So Lindsay, is there anything you would like to say at this point, please?
Thank you, Chair. Yes, just to set out the ask around the scoping report. So there's clarity around that. So this is an opportunity to establish the budget working group, as you know, with the aim of taking a deep dive into some critical budget areas, depending on what you feel as a committee warrant that. And it is very much about lending your test and challenge to the developing budget in your capacity as a critical friend, with the aim of making the overall budget more robust. I'm sure members are all aware of this, but it's worth reiterating that this isn't about being a numbers expert or a budget expert, but good scrutiny around budget is about testing and challenging the policy choices around those budgets, and having a good grasp of what they are. In terms of the ask that is set out in the report, you're being asked to establish a working group as it is set out in that report, but filling in the gaps around the membership and the key lines of inquiry in particular. I've already mentioned earlier that it's a really good idea to keep the focus as narrow as possible in terms of not overreaching with your scope, because there will be 2 meetings held for this working group. And the same will be the case for all the other working groups that are being established by each ONS committee. So 4 working groups will run concurrently through October, which is the reason why those meetings are so limited. Also, the timescale is about you being able to have some influence over that developing budget whilst it is being formulated. So we don't want you to be sort of overrunning in terms of the number of meetings that you want to hold. Just to give you a flavour of what the other ONS committees have done, in case that's a helpful guide to you, both Environment and Place and Children's Services committees have now established their working groups. They've both selected 2 key lines of inquiry. Environment and Place will look at bed and breakfast and temporary accommodation costs. And they will look at the budget associated with reaching carbon net zero targets. And Children's Services will look at school transport costs and care growth forecast. So that just gives you an idea of what the other committees are doing. With that, I'll leave you to have a discussion around what jumps out as the priority areas for you. Thank you.
Thanks, Lindsay. If just take this a step at a time, if I may, I did send out an email a little while ago asking for expressions of interest in people who might want to sit on the budget working group. We were looking for sort of 3 or 4 people, ideally. I did have a number of 5 names actually returned, but I think I think it's fair to say some of those were a little bit date dependent. Most of this work is going to be done during the month of October. So if that rules anybody out, then I just need to flag that up. But the names that came through with an expression of interest were myself, Councillor Denman, Councillor Salmon, Councillor Moriarty, and Councillor Richardson. So I just need to check whether, given what I've just said about time commitments, whether that is still the case, and indeed to ask also whether anybody else would be interested in being considered for this working group. So, Councillor Richards, sorry,
Chairman. Because you've got so many offers, I'd like to stand down again now. Thank you.
Yes, I'm overwhelmed with offers. Councillor Richardson, you. No, I think it's fair to say that the bulk of this work is going to be done in October. In the rush of people leaving, I'm left with 3 names, which is myself, Councillor Salmon, and Councillor Moriarty. Is there anybody else who would be particularly wanting to be added to that list? Okay, I'm going to pause there then. Lindsay will remind me in a minute that I need to get you to agree a lead member of the group. I'll come back to that in a minute. In terms of the key lines of inquiry, I think this is probably what may take a little bit of discussion based on what we've discussed today and the areas that we've been looking at within the budget. We do need to pick out a couple of issues that we need to look at. So the suggestions were, and they were no more than that, based on the perceived pressures within the budget. One was on the learning disability and mental health budget, and also on demand pressures, which actually we haven't talked much about, but we kind of know that they're significant within the service. But they don't have to be those 2, or you can have different ones. It's up to you what areas you would like us as a working group to look at. So are there any particular thoughts about that? I mean, do we, for example, want to pick up the point which I think was raised earlier about trying to find a decent form of words of the impact of the transformation on the service that is given to residents. That's a very clumsy phrase, but given the discussion that we had about that and kind of, for the want of a better expression, nervousness that the service isn't going to be impacted by that transformation, whether that is something you want to look at, whether the issue of supporting people at home is an issue you want us to look at. You know, those are all issues that we can look at, but obviously, as Lindsay's pointed out, we need to be fairly focused and just pick out a couple. So any thoughts? Councillor Allen.
I would offer to be part of this, but October's pretty much out for me as well, unfortunately, for various reasons. Yeah, I mean, I'm not going to be part of the group, so I apologise, but I do think that focus on how we're delivering care to people, particularly home care at home, which I think was a big issue during COVID, where people ended up in care homes before they probably needed to go there. And I would like to make sure that we are we have good balance in the budget to make sure that we're delivering on that as much as possible. But that's just my personal ask, and I would like to make sure that that 5 million, gosh, it was just £5 grand, it wouldn't be worth talking about. That 5 million that we gave away is not going to impact as well. I'd say both those things if it was me. Thank you.
That's the seven.
So I think I'd really want us to look at the kind of data collection that's going on, which touches on what Councillor Anne-Marie was talking about when we said about, can we see a drop in service? You know, when we slash all this money off the budget, how do we see that we're not suddenly turning up to appointments later? You know, waiting lists don't go up. I'd really like us to delve into that we've got the link between activity and spend working, and then really like us to scrutinise the forecasting, because there is part of me that really worries we're already technically insolvent, aren't we? I mean, with Brassic in February, we're bankrupt. So to only have a 3 whatever it is million saving on one of these big budgets that actually constantly goes up when the money we're getting from everywhere seems to still be going down, I would like to make sure we've got a functional canary in the coal mine that would be able to see if all of this budget stuff, actually in 5 years' time, you know, you're just skin, you know, 5 years' time, none of this will work on these projections, on these savings with the spendings that are coming through. I think we should really scrutinise that.
Yeah, thank you. I think it's probably just worth saying that in terms of the data and that aspect, that will be looked at within the transformation work that we're going to be doing. So we will be doing a very close examination of that in that context, rather than in the context of the specific aspects of the budget, if that makes any sense. Sorry, Jenny.
Yes, and those longer term questions about the budget overall and transformation and what it can deliver, I think are appropriate for your scrutiny of our transformation programme as it goes on. And then I think that's a specific aspect that actually the Cabinet asked for. Are we on track? And indeed, it was the point that was raised at Council, wasn't it, about can we deliver this and what will the impact be? I believe that in terms of these working groups, the focus is intended to be very much on next year's budget, because it's about influencing next year's budget setting, which I agree that feels quite constraining with some of these big demand-led budgets, but I think the greatest influence will be on answering, focusing on a more focused point. But some of the different elements that we've talked about, including the £5 million and what impact that will have, some of the questions about service levels, I think you could group those together under the header you've been given around demand management, because actually that's the core of how we think about managing that big budget in the context of next year, and some scrutiny around, well, what's realistic, and is the 5 million too much, and you know, what are those further pressures that we're going to have to absorb? Those are core questions that we will be trying to answer over the next period, and the committee's focus on that would be only helpful. I'm checking in because I can see that Betty has a hand up.
Yeah, sorry, Betty.
I may want to comment on that too.
Can you add that? Just add something to that, please.
Yeah, if I may, I would support that it may suit members, and of course this is a member decision to decide. But if I was to guide members, I would be guiding in the direction of demand management, and I think demand management has a big umbrella with lots of things within it. And I think what might be helpful is if members were to go with that, then to scope out what areas within the month of October that we were going to look at under that. And it might be that we pick 3 key areas, and it might be that we, you know, I know that listening to Councillor Salmon and listening to Councillor Allen and Mariarty, that there were 3 key themes that were coming out from you. And it was around care, it was around individuals waiting, and it was around what does our data tell us. And those are kind of to me, they're almost interlinked with one another, and that is some of the work that I'm beginning to look at within adult care, particularly around our waiting lists and also our reviews, and what might that look like in the way of financial need that may not yet be factored in because we haven't had the opportunity to really scrutinize the detail within those, and may that tip the budgets and allocation either way, the pressures that that would bring. So that might be one area that members might want to look at under the demand management, because that potentially could be a risk area. And I would say it's probably one that I'm beginning to get really focused on because of those reasons. And that fits very much into our budget setting and our budget planning, and also our budget risk and how we are identifying that. Thank you, Chair.
No, thank you, Betty. Councillor Allen.
I was just going to say I probably do support that approach, because when you take away all these conversations, we're getting back down to what our residents are experiencing. And if it's about whether they are getting support, review, assessment at the right point in time, then I think that if we've got a short pace time to look at a budget right now, I apologise, I'm not part of it, but I would really support that. Thank you.
No, thank you. And just to reassure you, Joe, that we will be having a deep dive on that data stuff within the context of the transformation. So I need just to come back to whether or not we're content with the suggestions that are in the paper of in terms of the budget and trying to influence the budget for next year, that we focus, the working group focuses on the learning and disability mental health budget and the demand pressures and all of that entails, which sounds quite a bit of work. Is that something which people feel happy for us to do? Okay, thank you. Sorry, Lindsay, your little hand is too far away.
That's all right, Chair. Maybe I should do this on the screen. I was just going to say to you that the lines written within that report, so including the learning disability and mental health budget, they are very much, they were early suggestions put in there to give an example from officers. They are not put in there as proposals asking you to agree to them, very much just examples. And it does feel to me that what has been suggested and fleshed out by Betty around demand management could potentially be really quite a meaty piece of work just in and of itself. You've probably got about 4 hours, if you think, in terms of your scrutiny meetings to look at these in 2 working groups. So that may be enough in itself. Of course, if the committee is very keen to look at the other budget area around learning disability and mental health, that's fine. I just wanted to make sure you were aware that there's no obligation to.
No, thank you. That's a helpful check. Councillor Salmon.
Just because it would help me make up my mind, will we be doing the session on the transformation project before we're going to be doing this deep dive into the budget? Because I think that would almost, if we've looked at transformation first, that would make looking at the budget easier almost. If we've got our heads around how the data's coming in, how it's being used to forecast and all of that, that makes scrutinising the budget easier. If we're not looking at that first, I almost feel like that's what we need to do before we can even specify an area of the budget that we are going to tackle. I feel like we need to sort out a high-level pre-analytic vision of how we're going to examine the budget before we go demand pressures, learning and disability or whatever, if that makes sense.
I understand what you're saying, but I do think it's 2 separate pieces of work. Sorry, Betty, do you want to say something?
Sorry about that. I can comment a little bit on what Councillor Salmon's just said as well, Chair, if I may. But going back to what Lindsay just said, I would echo that the demand management would be sufficient. I wouldn't, and again, this is up to members to decide, but I don't see the point in splitting learning disabilities and mental health, because you could equally say around other areas. And I think within adults, it's easier to look at them as a combined rather than breaking down into segments. And I think that looking at it under the umbrella of demand management will bring out lots of the stuff that will be in each of the areas anyway. So if you're looking particularly, if members were to go with those waiting for assessments or whatever, that would be across. That wouldn't be specific to learning disabilities or mental health or autism, or specific to long-term conditions, or specific to drug and alcohol. It would be all of it together, and I think that would give members a much wider understanding of the kind of holistic, the overall numbers of those waiting, and the kind of holistic kind of scenarios that are going on across those areas. And then just on Councillor Salmons, I think that you probably won't have the transformation stuff before October, before this piece of work. I mean, Gillian, please do come in if you've got a different view, but my understanding is that we've broken the transformation work down into those 4 key programme areas that we touched on earlier: better short-term support, self-directed support, and the how we work, and so on. So those 4 work streams will be each really doing deep dives into those areas and what's within those areas, and that is very key within all of those work streams. But very specific mainly in one, and I don't think you're not gonna get that before this piece of work around the budgets. And I would suggest, and again this is for members, that they can both be running alongside one another. I think it depends on what we actually set as the context in terms of reference, what members set for the deep dive into the budget. Don't know if that's helpful. I hope it has been. Thank you, Chair.
Sorry, Gillian.
Can I come in, Chair, just on that same point? I wonder if what we could cover in that budget working group at the start of it is almost a kind of factual briefing from Betty and the finance team and those who are closest to it, that just sort of explains in more detail how the budget's structured. Because I wonder, Councillor Salmon, if that's what you're getting at, because I know some of the questions you've been asking are kind of under the surface of the pie charts. Well, I agree with you, it's quite hard to know where to focus without having that understanding of where the data flows in terms of the budgets. And I think we could do that as by way of introduction before going into the topic of demand management, because the two things are linked. And I actually think that will help in then the following conversation to say, and what's transformation doing on that over a longer term period of years. So I think we could structure it in that way. And I absolutely support Lindsay's suggestion, although it is for you as a committee, that broad topic of demand management, but broken down is a substantial enough topic.
Okay. So I think in terms of where we go from here, the timescale is such that we have to do the budget work first if we are to meet the objective that we set ourselves of trying to influence the budget as it's being set, bearing in mind that we're going to be starting to have fairly detailed discussions come November about what the budget in the new year might be looking like. So but bearing in mind what Julian's just said, I think we could probably do something in order to deal with the data aspects of the transformation first, in order that we can try and run these not exactly parallel but close enough to it so that we're actually aware of the issues. So what I guess need to do is to ask the committee whether on reflection, you feel that just dealing with the kind of demand pressures and all of that entails is something that we should limit ourselves to. Say limit, but it's not really appropriate, is it? But just to deal with demand pressures as a single issue for this particular budget working group.
You're right, I'd say yes.
And I agree. I think it would be, I really like what Betty is saying about having a holistic picture. It would also be good to know that the data was there for individual services so that we know that, you know, for instance, if we're looking at demand pressures, they're going to be completely different in one area to another. You know, is there any way of juggling the budget to make it a bit more even? So whilst I absolutely agree, we've got to look at things holistically. We have to look at breadth. We also need some depth as well. And if we have depth, we actually potentially could end up looking at learning disability and mental health budgets, you know, just by dint of depth.
Yeah, and sorry if I just think, before I just take answer, I think it would be fair to say, wouldn't it, Betty, that in the process of doing that, you know, looking at the demand pressures in the context of the budget, we will be able to say to you, where are the pressures? What is the data that is supporting you in making that kind of strategic decision? And, you know, where does that lead us in terms of trying to make an assessment about what the budget looks like? Councillor Sanders, right?
So I like the proposed idea where we do a kind of, we get our heads around the structure of a budget first and then we do a dive in. The only bit I'm a bit reluctant about is, like you said, what we're looking to do is pull out, oh, actually, where can we be a useful critical friend and identify where we can have input. And we probably will look at demand management, but I wonder if, like you hinted at, maybe when we're looking at it, we go, oh, no, God, we should definitely actually look at learning and disability and mental health, you know, because of what we've concluded in these first 10 minutes. Can we be empowered by this group to almost wing it? You know, we'll probably look at demand management, but we'll start off and then we will dive into whatever we feel is most relevant, or do we need to commit to exactly what we'll look at when we finally meet now?
Councillor Allen, how do you feel about winging it?
Well, it is about what influence we can have, isn't it? At the end of the day, which I'm always sceptical about, but there we go. I think that if we look at where the pressures and the demands are and where there might well be budget pressures going forward, that's where we might be able to influence the budget in the next financial year. And if that takes you along a particular road, because that's where you find that the biggest pressures are and the biggest demands are that aren't being met, then I would say you follow the information and the data where the information takes you. So if you come back and say, well, we ended up looking at this because this was the biggest demand, the worst waiting list, the worst performance, and that's what we needed to highlight to get a better budget around that particular area, then I'd say follow where the data takes you. Thank you.
That's helpful. Lindsay.
Thanks, Chair. I will capture what has been discussed today and what you ultimately agree in terms of your key lines of inquiry and share that in a document to you as a committee. If you have any very particular data requests there or information requests that you do want to focus in on, that's sort of an extra point for you to reflect and be able to supply that back so that officers can really respond to that within those meetings for you. But I can't stress enough that the time limit is quite short, and clearly you're going to get more out of those sessions if officers have a really good idea of what you do want to focus in on beforehand. So whilst you will be free to ask the questions you want to ask within those sessions to test and challenge appropriately, the more you can be clear ahead of that and keep to a scope, the more value you are likely to have.
Thank you. We'll capture that somehow in the minutes, but does that seem like a reasonable way forward? And that we'll stick to demand pressures and see where the data takes us. Okay, everybody content with that? Okay, so just a couple of the things then to finish that item off. just need to check with you that the measures of effectiveness for the working group as set out in paragraph 15 are acceptable. Seems okay to me. Everybody happy with that? It's just a means by which we assess the benefit of the scrutiny work that we're doing. And then the other thing that we need to do is to, because Lindsay will remind me if I forget, is to appoint a lead member from the 3 people that we have identified earlier. Councillor Moriarty.
Can I nominate Patrick, please?
You realise you will pay for that afterwards. Is everybody content with that? Thank you very much. Right, Lindsay, is that us done on that item? Do you think have we covered everything we need to cover on the scoping?
I'll just ask now, can officers confirm would Betty be the most appropriate lead officer for that, given your input? Thank you. So yes, adding Betty's name into the list completes all that we were asking from you. So thank you very much.
Thank you very much indeed for your help with all of that. So we're just going to move on to items for information, and the overview and scrutiny annual report has been submitted. I think it's been submitted in several places, but it's just there for information. I'm not going to take any questions or anything on it unless somebody has got anything desperate to say about it. Okay, are we content to just receive it? Thank you. And then I won't forget this time, Councillor Brown, your portfolio holders update, please.
Thank you, Chair. Yeah, I'll try and keep it fairly brief, just as an update of things that have been moving along over the summer, and try and keep it as informative as possible. One of the biggest areas over the last month or two have been meetings and discussions in relation to Tricuro, and which our members have sort of spoken about before. Just to make you aware, we are Tricuro currently has an interim chief executive. Tricuro currently has an interim chief executive, and they're now looking at commencing the recruitment process for a permanent chief executive, and also for a new independent chair to replace Charlie Sheldrick, who sadly passed away in August. He was a really sort of, for those that sort of have known him over many decades, he's been active in the local sort of health and social care community, and was previously at Poole Council, and he was the independent chair of Tricuro, and he was really dedicated and influential presence in sort of local social care and health world, and will be really missed. And I think people at Tricuro will really miss his presence as the chair there. So the recruitment process for a new independent chair will be starting soon as well at Tricuro. There's a lot of activity within Tricuro. You'll be aware about the Fairways Care Home. The last I heard, it has just a few remaining residents there and is due to close at the end of September. Day opportunity strategy implementation is progressing, and the changes at the day centres, including moving those at Poole Plus, moving over to Parkstone Connect, is well advanced now. The discussions we've had, there's a lot of pressure as a result of those on Tricuro's finances, and there's staff consultation going on regarding those changes and the impact on individuals' jobs. But certainly in the meetings we've had, we have a very good working relationship with Tricuro, and we've had a number of sort of stakeholder governance meetings, and they've got a board meeting later this week, which I'll be attending as well. There are a lot of changes across the health and social care world, across BCP, which will, over the next year or two, will be noticed by all residents, particularly across the NHS. You'll be aware over the years the clinical services review, which is really sort of coming to the point where the changes will be noticed in the next year or so, with maternity opening up in Bournemouth next spring, accident emergency in Bournemouth next autumn, then the planned treatment services in Poole. I was invited to the beach building at Bournemouth Hospital, which you'll be aware of, which is still a building site, but it's nearing completion. It's been fitted out internally, and certainly from what we saw on our trip there, it will offer a sort of complete step change in the sort of quality of accident, emergency, and critical care in terms of the sort of facilities that will be there. And there's another new, I think it's a 5-story building just about to commence on site over in Bournemouth, at the new catering and specialism building. It's not yet got a name, but I certainly sat in on a meeting discussing potential names for the new building. And that's all part of the sort of 500 million, well, it's up to about 500 million pounds investment in health services and new buildings and hospital facilities across Dorset. And that will really, will really have an impact on everybody in the area. Linked to those changes in Dorset's health system, you've just been discussing adult social care transformation, and I think it's critical that adult social care transformation works and delivers, because it needs to integrate with the changes going on in our health system locally. And also there's been a lot of work on urgent emergency care system review by Newton. You'll be aware that sort of consultants from Newton have been undergoing, there's been some intense work over the last couple of months across Dorset, and the initial findings of that work are being presented and being considered at the moment. And all of those sort of work together with the changes in our health system, that looking at the sort of pathways and the ways of working in our health and care system, as well as adult social care transformation, how we relate to the health system and how we link, all need to sort of work together. So there's going to be a lot of change for our sort of staff through transformation, but also through the sort of wider health system across BCP. Other than that, I don't need to update on public health. Sam gave a very, very detailed and comprehensive update on what's happening with public health. The next Health and Wellbeing Board is on Monday, the 21st of October, and certainly place-based partnerships will be part of the sort of discussion at that meeting. Other than that, the CQC, we're still awaiting news or dates for an inspection by CQC. A lot of other authorities had a meeting just a couple of weeks ago with other adult social care portfolio holders, and a number, Bath and North East Somerset, South Gloucestershire, North Somerset, were all had letters and been given dates, and the inspections are sort of commencing in those areas. So it seems quite a lot of the sort of Somerset and Gloucestershire area have had it, but they've yet to get to Dorset, but we expect we'll hear soon.
Thank you, David. Any questions to the portfolio holder? Thank you, David. Yeah, just I guess on behalf of both of us, to thank Betty for arranging the visit to the beach building. We just kept going around the place saying, "Wow!" It was just an amazing, going to be an amazing asset. So thanks, Betty, for arranging that. Okay, going to move on then to the work plan, and if Lindsay is still with us, to invite her to present this item, please.
Thank you, Chair. I will certainly take you through this. You'll be aware, members, that you held your annual work programming workshop, I think in the summer now, thinking back. And following that, we surveyed you on your priority areas so that they could be formally established and agreed by the committee. So this work programme is now set out on the basis of all that work. It is now provided to you as a draft, and you're being asked to agree it. Just to take you through the format of it, you'll see that it's colour coded into proactive scrutiny, reactive scrutiny, and pre-decision scrutiny, and this is colour coded throughout. This has been set out so that you can realistically plot the amount of time that you have to address different types of scrutiny through the year, but there's by no means a assumption that you should rigidly work towards this, and it can flex throughout the year as appropriate. In terms of those priorities that members set out in the survey responses, thank you for the responses that we received. They have now been set out within your 4-plan report, and they are numbered 1 to 5. So if you scroll through the report, you will find those. The next stage in bringing this 4-plan together is to plot those into the relevant meeting dates. And that's something that Louise is liaising with officers to do, to find the most appropriate dates to bring those forward. The other suggestions that were made from members are in the next section of your work programme, titled the long list. So they are by no means lost, and they are on there and can be flexed into your work programme as appropriate and according to the committee's wishes. So that's just an overview of what your work programme is looking at like now. We've agreed tonight to plot in some capacity throughout it for regular scrutiny of the transformation programme, and we'll do that for you. Moving to your December items, let me just bring that up just to clarify what you've got coming forward. So you've got adult social care waiting times listed for December. That's something that we will send a key lines of inquiry document out to you on very shortly, because that doesn't have a great deal of scoping around it. So just to make sure that the officers can respond to any data requests and information requests around that. And the chair has suggested healthcare for the homelessness as a reactive scrutiny item. Chair, you might want to expand on that for the committee, as this has been added in since your last committee discussion. Shall I pause there so that you can address that, Chair?
Yes, thanks, Lindsay. This was the report that was issued by Healthwatch recently on healthcare for the homeless. I think it's a really interesting piece of work, and I just asked the question of whether we could find some time within our programme to have a bit of a look at it and to probe a little bit further about what the situation is. So suggestion is that we could have a look at it in December, but that, I guess that's me using my chair's privilege to try and get that item on the agenda, because I just think it is an important piece of work. Councillor Allen.
I was very pleased to see your email requesting that, because I was about to send one and I, oh good, Patrick's got there before me. I think it's really, I really would like to see this scrutinised. That Healthwatch report was very damning. I'm just, if you forgive me for a second, I did have a role as lead member in homeless care around the time when we were in administration, and we did a lot of work around homeless healthcare. I have to admit, I have a vested interest in this, because I lead a team in the hospital that looks after patients that come into hospital that are homeless or experiencing homelessness or at risk of homelessness. So I do have a vested interest. So I'm just declaring that. But we did a lot of work on this, and we were working very strongly towards a properly commissioned health service for the homeless in BCP. And I honestly don't know what's happened to that work, where it's gone, and it's very sad. I was very sad to read that Healthwatch report, because I think it could have been written pre-COVID, and I think we've lost a lot of ground in what we achieved through COVID. And I just wonder whether we could actually ask not just Healthwatch to report to us, but find the most appropriate officer. And I know that Elaine Hurl was leading on it previously, but I believe she may have moved on to another position. But I think we need to find who the officer is that would be responsible for that, and I'd really like to hear from them about where that work has progressed and will progress in the future. So I really would like us to, and I think it is timely, because that report was very, very hard reading. Thank you.
Is that possible, Jane?
Yes, and I mean in anticipation of this, because the chair had asked us to think about putting this report onto scrutiny. I think you'll want to hear from BCP council officers, both from the point of view of some of our homeless services and how we work with people, from adult social care as well, because I think that there is a responsibility there, but also from our health colleagues. And I think we'd want to bring that whole picture together. I mean, one of the things that was striking from the report was around access to GP services and how that operates in relation to our homeless population, and that really is a central point in terms of that equality of access that I know the committee has said they want to scrutinise. And yes, Betty has a hand up behind your head, Chair.
Betty. I'm going to get big. I'm going to get you to get bigger hands. I'm going to get those big red things that you wave in rallies and things.
Yeah.
Thank you.
Yeah, I think just picking up on what Councillor Allen had said and Gillian there, I think maybe focusing some of this around our homeless intervention team that deal with people that come into hospital, but also do some other work, and that is joint, that is health and social care, and that's funded specifically around those areas, and that will give some very clear insight into that area. So maybe, as Lindsay said, around the one around the waiting list, if we have a bit of a inquiry scope around what we're being asked for within that report, then Louise, I can certainly work with you about directing it to the right key officers so that we can pull that report together if members would want that to come in December. Thank you.
Thank you very much indeed. Councillor.
So I was just going to say, in terms of what's on the action plan at the moment, I was a bit frustrated that we couldn't have my request for the gender identity services. Okay, I've got another thing, but I'll wait.
It's fine. It's fine. I've got on my list of things to cover. Okay, so just in terms of that issue, we're committee happy with the idea that we bring it forward to the December meeting, that we ask Healthwatch to come and present their report, and we will try with Gillian and Betty's help to identify an appropriate officer to come and give a BCP perspective. Okay, is that okay? Councillor Salmon.
I think that's probably fine. I've just got, and this is a little moan I've got about something that I don't feel worked brilliantly. So last year in July, 15th of July, we had a fella from Tricuro turn up and he talked to us for a bit. And then 5 days later, I had residents contacting me about the closure of Fairways Care Home. And I don't think, now maybe I'm a rubbish listener, but I don't think the closure of that care home was covered in the update we got from Tricuro. And I'd just like to make sure that if stuff where we're doing the action plan, I feel like just as a rule of thumb, if there are going to be any closures of services or anything like that, that trumps everything else that we have on the action plan for adult health and social care, overview and scrutiny. So I think probably the healthcare for homelessness is absolutely good. I like that idea. But if before December, anything else is due to close, I really want closures to come to ONSs before they happen. That was my 2 pence.
No, that's fine. I think it's probably just worth saying by way of declaration that care home is in my ward. But the closure of that care home was a consequence of the budget that was agreed by the council. So it wasn't anything to do with anything that happened subsequently. So I think the reason it wasn't in the Tricuro report was because it had already happened, it had already been agreed, and it had already been agreed by council. But having said that, the point is still valid that we need to be perhaps a little bit more fleet of foot, as one of my colleagues would say, in order to be able to pick up those sorts of issues as they come through, because it was a bit of a shock to me that it had, I couldn't say lost in the budget, but it was part of the budget and part of the daycare and all of that reorganisation within Tricuro. But yes, we'll try and be a bit more, on the ball in terms of stuff like that. Thank you. Lindsay, I think I interrupted your flow.
No, Chair, I don't think you did. I think I had covered most things that I needed to say. I would say that with the discussion we've just had around healthcare for the homeless, that looks like it could be quite an in-depth inquiry session at December, and to bear in mind that that could take some time. But I would just ask Gillian, perhaps if there were any pre-decision items coming up for Cabinet in that timescale that needed to also be plotted in and raised to the committee now for December, with that caveat that you already look quite full with just adult social care and the homelessness item.
I'm not aware of any pre-decision items beyond those that we've put on your radar. I think there's been a fairly full scoping as part of this planning. That's not to say that things won't change, because things do change, as you know, as we go along.
Okay, thank you. So in terms of the list that's in the paper, about items which we've identified as things that we would like to discuss, but where we haven't yet allocated the date and we're not in the 5 priority areas that were picked. I just wanted to pick out a couple of things. One was the point that Councillor Salmon raised before. So when Joe raised this before, the thing that struck me, because my brain works like this, is I wondered what does the service look like now? What are we doing now? What provision is there? Is it going to change? Where are the if there are stresses in the system, where are they? And the consequence of asking all those daft questions was that Kate Calvert, who's been attending our meetings at this committee previously from the NHS or stroke ICB, did indicate to me that some work was going on at that level about that whole issue. And what she indicated to me was that the NHS Dorset Quality Committee, I don't know what that is, but I'm sure Sam does, we'll be looking at a report on that specific issue. So it kind of seemed to me that it would be a good idea, or probably more helpful, for us to see that report once that work had been done, and therefore we would have a slightly more informed view about what's going on and what the challenges of that service might be. So if that's wrong, Joe, then fine, it's all my fault.
No, that sounds all well and good. So we're going to get a report at some point from Kate Calvert that will be, so we won't necessarily look at that here and now in a committee, but it will come to us and then we can go, oh God, that all seems very tedious and dull, but ultimately fine. Don't worry about it. Or we can go, oh, we've got some burning questions on this. Let's whack it on the agenda for the next one, basically. Seems fine by me.
Okay, thank you. But it hasn't been forgotten. I think that's the key thing from my point of view. The only other issue that I wanted to flag was one of the things that is on that list is all ages neurodiversity review. And it sounds a bit academic, for the want of a better expression. But I attended the annual meeting of NHS Dorset a few days ago, and the chief executive was stressing how important this piece of work is. And it kind of led me to think that I actually don't know anything about it, really. So at some point, I might, well, with your agreement, ask people to actually give us some kind of update or report about what was happening with that review, where it's at, what's being looked at, where that service is going. So I'm just kind of declaring that so that you're aware that there does appear to be stuff going on in the background. Sam, are you able to add anything to that? I'm just talking in rubbish on there, really.
I think it would be helpful for the committee to form some focused questions, because depending on where you look, the problem might be quite different. So I'm aware of it because of complaints around the way that children and young people might be waiting for assessment or for diagnosis, and the way that we organised our services currently means that it's very difficult for families to get additional support until they've got that diagnosis, and lots of families are paying to go private. That's sometimes how this issue comes to the fore. So there's a CAMS transformation piece of work that's going on. CAMS is Children and Adolescent Mental Health Services, which is supposed to be looking at a very different model, which is providing support to children and young people and their families at a much earlier stage, rather than saying you've got to wait until you've got a diagnosis and you've reached a threshold, because there are lots and lots of children coming forward with lots of complexity, and the current model can't sort of cope with that as it's set up now, if that makes sense. I'm not that familiar with the all age work, so if Patricia was talking about extending that into mental health services for working age adults, I think that'd be a very good thing. The most important change that I've noticed that's happened in the past year is the opening of the Access Wellbeing Hubs, which some of you might be familiar with. So again, they're trying to take that model of earlier access and making sure that those hubs are close to communities. One's in the Dolphin Centre. There's a couple more that are planned to open, including one in Weymouth and Portland, and I believe there's another site that's been identified. That's the kind of direction of travel. So I think it'd be a very good question to ask.
Yeah, thank you, Sam. So I guess I'm really just kind of illustrating that if there is anything on that list, or indeed anything else that's not on that list, that you think we need to get some kind of update or report on, please just let me know. Because I think I've absolutely no idea how that impacts on adult social care, but I'm sure Betty does. So we probably will want to, I think, just check where we are with it, as we may do on some of those other items. So are we content then with the work plan and what we've discussed as a way forward? I'm just looking to see, just checking that there are no hands waving at me on the other side of the screen. Okay, thank you very much indeed. Right, I think that brings us to the end of the meeting. Sorry, it's run over slightly than I anticipated, but thank you very much indeed for your time. Just to reiterate the thanks to those colleagues who bothered to send in the forms on the questionnaire about items that they wanted us to have a look at. Very grateful for that. Very grateful to the officers for their support. So thank you all very much indeed.